Have you ever felt a strange pain just under your left ribs and wondered, is this something serious? You're definitely not alone. It can be harmless, or it can signal something much more urgent. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. That's why everything I share in this video is doctor-reviewed and approved. Let's talk about left rib pain. This part of your body might not seem like a danger zone, but the truth is it protects major organs: your heart, left lung, spleen, kidney, pancreas, and parts of your stomach. So, when pain shows up here, the cause can range from totally treatable to potentially life-threatening. One case I remember was a woman who came in convinced she'd pulled a muscle lifting her kiddos. But after a few questions and a simple test, she was diagnosed with a kidney infection. Quick antibiotics, and she was good to go in a few days. The point? Listening to your body and taking symptoms seriously matters. Let's break down some of the more common causes of pain in this area. First up, costochondritis. This condition sounds complicated, but it's basically inflammation where your ribs connect to your breastbone. It's often from an old injury, repetitive strain, chronic coughing, or sometimes no clear reason at all. Pain from this is usually sharp and worsens when you press on the rib area or take deep breaths. The good news? It often goes away with rest, a heating pad, and over-the-counter anti-inflammatories like ibuprofen. Next, gastrointestinal issues. Conditions like IBS or gastritis can cause pain that feels like it's coming from under your left ribs. If you're also dealing with bloating, nausea, or that annoying full after 2 bites feeling, your stomach lining might be inflamed. Cutting back on alcohol, avoiding trigger foods, and managing stress can make a big difference. A warm cup of chamomile tea can sometimes help settle the stomach, too. Now let's talk spleen, something people rarely think about until there's a problem. Your spleen helps filter blood and fights infection. But if it becomes enlarged, often due to an infection, it can cause a dull ache or fullness on your left side. In serious cases, trauma can lead to a ruptured spleen, which is an emergency. Look out for tenderness, dizziness, and an unusual fullness after small meals. And don't forget about your kidneys. A kidney stone or infection on the left side can radiate pain to the front, under your ribs. If you're peeing more than usual, see blood in your urine, or feel a stabbing pain that seems to come in waves, it's time to visit a doctor. Staying well hydrated can help prevent kidney stones, and for mild infections, antibiotics can usually do the trick. We also have to mention the heart. While not every pain under the left rib is a heart attack, it's vital not to ignore the signs. Pressure or heaviness in the chest, radiating pain to your arm or jaw, shortness of breath, or sudden dizziness. This isn't something to sleep on. Call emergency services right away. There's also something called pericarditis. That's inflammation of the sac surrounding your heart. It can cause sharp pain that worsens when lying down and may follow a viral infection. I once saw a young athlete dealing with this after what seemed like a simple cold. Luckily, with the right diagnosis, he was back on the field within a few weeks. If your pain is due to a muscle strain, bruised ribs, or posture-related tension, using a cold compress in the first 48 hours can help, followed by gentle stretching. Make sure to get quality rest and avoid activities that make the pain worse, and always check in if the pain hangs around. So, how do doctors figure out what's behind the pain? It often starts with a physical exam and possibly lab tests or imaging like an X-ray or ultrasound. Sometimes, you may be referred to a specialist, whether that's a cardiologist, gastroenterologist, or kidney expert, depending on what's suspected. With so many possible causes, it can be overwhelming. But you don't have to figure it out alone. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. Thanks for watching. Be sure to like and follow for more doctor-approved info you can trust from me, Dr. Mickey, and the team at UB Health.